everyone. I'm Don McCormick, Chief Storyteller here at Vital, and today we're talking with Mike Rogozinski. He's the Director of Quality and Innovation at Vital. Hi, Mike.
Hey, Don, how are you? Nice to see you again.
Nice to see you too. How are you doing?
Doing well, doing well.
Good. So, Mike, you've had a lot of leadership roles, right? You're a registered nurse, but in the hospital setting, you've been in leadership positions. Throughout the course of your career, how has that approach to measuring patient satisfaction changed or evolved?
Well, I can talk a little bit about when I first entered the nursing career almost 20 years ago. The focus on patient satisfaction, I don't think was as big back then. I don't remember hearing a ton about it as a bedside nurse. As I moved forward in my career, once I moved into management, that's been over a decade ago as well. It certainly became a larger focus. And then I think across the board, it became a larger focus for hospitals in general. This has a lot to do with age caps and reimbursement that was not always in play. And now there's a direct correlation between patient satisfaction scores and reimbursement for hospitals. So that's pretty big.
So that's on the reimbursement side. Let's talk a little bit about reputation management, right? Of course, the word consumerism is not new in healthcare.
Yeah.
Maybe relatively new compared to other industries, right? But it is here to stay, right? It's established a firm foothold. So I'd like your take on online reviews. How are hospitals approaching this as an indicator of business performance?
Well, that's an interesting question because hospitals are only recently paying more attention to their online reviews. I think that smart hospitals are focusing on their Google reviews specifically because gone is the day of people being loyal to a hospital. You know, my father went to this hospital, so I'm going to go to this hospital. We have a huge amount of our population that moves quite often. So you don't have those hometown roots and those established relationships with physicians that used to exist years ago. And that's what they're doing. They're going online. They move into a new area. They're going to look up hospitals near me, ERs near me. And if you have two ERs within driving distance and one is 1.8 Google stars and one is 3.9 Google stars, it makes it an easy decision where those patients are going to go. We know that if patients aren't coming, that's a reduction in volume and that's a reduction in dollars.
You mentioned ERs specifically. Why does that matter?
The ER is the front door to any health system. I think nationally, we're looking at about 50% of patients come through the emergency department that become inpatients. The ER is a first touch point. It's that first impression. It means a ton. If you go into an emergency department, you have a terrible experience, the likelihood that you're going to follow up with specialists from that health system goes down. It's hugely important that you capture that future business at that front door. You give them a good experience in their emergency department, and then they have a good experience to work off of when they're deciding, am I going to get a primary care doctor that is affiliated with this hospital? Am I going to see an orthopedic surgeon that's affiliated with this hospital? I think that those, again, that first touch point, that first impression is hugely important.
And it's pretty important in terms of referrals you mentioned. Can you expand on that a little bit?
If you think about it as future business, and you hate to say it that way, especially when you're talking about patients and patients requiring care. But you know, when you take care of a patient in the emergency room setting and a hospital has all of these specialists, those are sources of revenue for a hospital. And again, the patient's experience with earlier physicians in their care journey will impact who they'll choose downstream. And you know, that's good for patients. You want that for continuity of care. You want all the physicians who are working on this case to be able to collaborate together. That can get mucky when they're seeking care at different health systems, or just whoever they Googled, they go see them. And then again, from the hospital side, that's revenue. You want to drive revenue.
What are some other metrics, just like as you're looking across, weeks and months and quarters that people in especially, because it sounds like ED is a really important place to be focusing on patient experience. What should EDs be focusing on as these indicators of we're going in the right direction?
Well, the ER setting is the land of metrics. I mean, we track I'll say most ERs track huge amounts of data points, huge amounts of metrics. Some of these are time-based. A lot of them are time-based. Certainly the focus in the emergency department is quick, safe, timely care. We've seen that by communicating with patients, letting them know that they haven't been forgotten, having touch points with them, decreases the likelihood that they're going to walk out and seek care somewhere else. And it also improves that patient experience. They don't feel like they've been forgotten. People know that they might wait 3 hours to get back into an emergency department, but when you're in pain and you're sitting in a waiting room, 3 hours seems like 3 days. So consistent touch points with that patient, letting them know like, hey, we're running some lab work on you. Whatever you're doing for that patient in the ER, make sure they know what you're doing. And through that, you'll drive your patient experience through the roof. Because again, I think setting realistic expectations, people, again, they already know kind of that it's a crapshoot when you walk into an emergency department, how long you're going to be there. So keeping them informed, giving them insight into how long they might be waiting. And again, communication can really help that.
Just the other day, I was talking to our CMO, Dr. Justin Schrager, and he made a very good point that communication in a healthcare setting is two-way, right? Certainly it helps the patient experience, but there's also an impact on the staff. Can you talk about that and how that is maybe a KPI that hospitals should be looking at?
Sure, of course. Well, in a world where hospitals are focusing on keeping staff engaged, keeping staff from leaving, turning over, and it's also a world where staff are being verbally assaulted, sometimes physically assaulted. It's a war zone in some ERs. I think positive feedback, when it's elicited, can have a huge impact on feeding into a more healthy work environment for care providers. Everybody likes to hear that they're doing a good job, but when you can hear meaningful feedback from a patient that you made a difference for them, that goes a long way. That's what reinforces why many people became a medical practitioner of some kind to begin with.
Well, Mike, we talked about a lot of things, a lot of different KPIs that emergency departments especially need to keep in mind in terms of patient experience. As we close out, is there anything else you'd like to mention to our audience?
Sure, yeah. Well, I think for me, if I want to give one takeaway, we talk about metrics a lot. Metrics are humans. LWOPs are human beings that walked out of an emergency department who needed care. RN turnover rates, those are humans. Those are nurses who left because they have given all that they can to an organization. So I think when we humanize those metrics and we remember that it's people that we're serving and people that we're supporting, I think it's important for us to remember that and to invest in that, right? We need to find solutions. We need to seek solutions to keep our nurses happy and safe, keep our patients informed so that they don't leave and they get the care that they need. And I think that that's the responsibility of hospital administration across the board. And I think when we do that, when we make people the center of our decision making, not only is it the right decision, but we can also find that our business metrics are met as well. So I think that that's an important takeaway.
Yeah, great way to wrap this up, Mike. Thank you so much for your time today. It was great talking to you. We'll do it again soon, I hope.
Absolutely.
And to our audience, if you'd like to learn more about Vital's patient experience platform, please visit vital.io. Thanks, everyone. Have a great day. Mike, thanks again.
Thanks, Doc. Take care.